Hey guys, Dr. Dobson. This one's going to be a big two-part case. We're going to be doing an upper and lower immediate all on 6 that we did for a dear patient. Before we get into the footage of the surgery that we're going to be covering in this video, let's go over the case. So here's the x-ray. You can see that the patient has one maxillary molar and a bunch of periodontally compromised lowers with some endo lesions here and there. There was pain. He had difficulty chewing with his upper denture. Here's a photo of the upper denture. It just had the one tooth and it didn't fit great. So we actually got to talking just out and about town. I met him and he said that he was going to Costa Rica to get this surgery done and then going back to have it restored. And I said, hey, well, that's something that I do, so I'd be happy to do that for you. So here's a post-op of the surgery with 6 implants. We did it all in one go. 6 on the top, 6 on the bottom. And then 3 months after we had him back, we scanned. Here's some footage of the scan. And then I manufactured the fixtures in-house. So here's some photos of that process. Here's what they looked like post-sinter. And then here's what they looked like installed in the mouth. He made the request to make it look as close to the original denture as possible, and I think we got reasonably close. He was happy anyway. So let's get into the surgery footage. I'm just going to start it here, and we're going to go over the top. We're going to extract the 1/6 simply. Unfortunately, I don't have any footage of the lower, and also I lost some on the quad 1, but we're going to get going. We're going to use a tissue punch to punch through the mucosa, and it's quite thick. You can see he's been missing teeth on the top for some decades. And then we're going to spoon out the tissue punch. This is in 2 times speed, so it may look like we're working frantically, but it is sped up. So we'll expose a full thickness flap from the mesial approximate implant position to all the way to the extraction site there. We plan on doing 3 implants per quadrant. And then we'll peel that back with the periosteal so we have a good visual access to all of the bone, and we're going to place them with some flexibility in the sites. So here's some footage that I lost, unfortunately. Lost the osteotomy and implant placement for the 1-1 and 1-4 sites, or 1-2, 1-4 sites. And then we just close it up with some tissue adhesive. The 1/6 site, we're going to mostly use the palatal root to place the implant, and we're just going to use the pilot and then open it up. It skipped a couple of drills of the osteotomy drills. We'll place an implant, and then we'll do we'll get an ISQ. I believe that we had green ISQs for all 6 of these on the top and on the bottom, so we were happy about that. We'll put the healing cap on all of them so that they're slightly at or above the gum level so that we don't have to freeze when we go to scan. And we'll do quad 2 here. This is a native ridge with no teeth, obviously, so it's a nice clean site to operate. I think the flap got a little messy just because of how flabby the tissue was, but we'll peel it back and then we'll kind of scope out the sites where it looks like there's to be the most bone, approximately in the 2-2, 2-4, and 2-6 positions. Editing credit, and then once we have kind of decided where we're gonna put the implants, I'll put a little punch through the tissue using the tissue punch. We'll grab it and then start our osteotomy in the 2-2 site. Would have used a round burr first to make that little dimple, and then we'll go in with a pilot, open it up drill by drill until we have our 4.5 millimeter osteotomy. You're gonna place a 4.8 millimeter diameter, and these are all tissue levels, you might notice, because I find them much easier to restore. We'll take the polished collar down to the bone and then get an ISQ, which is going to read green for us on both orientations. Put a short healing cap on it and then move on to the next site. You can see there's good wide bone here, so there wasn't any lack of bone. We'll open it up to 4.5 and then place our 4.8 by, this is either a 10 or an 8 millimeter length tissue level implant, Blue Sky Bio. Video editing credit again goes to Dr. Francisco in Argentina. Thanks, Francisco. We get an ISQ on that one as well. We get green. Put a taller healing cap on that one. And the 2.6 will angulate the driver a little bit distally, but we didn't get anywhere close to the sinus anyway. So they're 4.5, and then putting in our final implant for the upper. We'll close it up, and then we would have moved on to the lower, but like I say, the footage is missing. I do have a bunch more implant cases that I'm going to be sharing in the future here, so if you want to subscribe, if this appeals to you, then feel free. And that's pretty much that surgery. Here's again some stills of the pre-op, post-op, and then here's some finals again, the x-ray and the photos. And I'm going to be putting out the restoration process in the next video, so stay tuned for that. Thank you.